And with us is Dr. George Thomas. Dr. Thomas, thank you for joining us today.
Thank you for coming.
Dr. Thomas, as a cardiologist, we'd like to talk today with you about some of the issues facing people and their heart conditions. First question that I would have for you would be what someone should do if they find themselves having a heart attack, or if you know someone who's having a heart attack.
The most important thing is to be aware of the signs and symptoms of a heart attack. Most people get chest pains or some symptoms similar to that. Say they may feel a burning sensation in the chest, or a pain in their arms, or they feel sweaty, short of breath. Some people feel just nothing but a feeling of an indigestion. They may keep taking an antacid thinking they will feel better. But whenever they feel any discomfort in the chest, or shortness of breath, or extreme fatigue, they ought to just look into that. And if these symptoms are severe enough, they should go to the nearest hospital. But the important thing to keep in mind is not everybody has the classic symptoms. Especially if you're a diabetic, quite a few of those people may not have any symptoms. So we call them silent heart attacks. Keep in mind the most crucial thing is time. Time is everything when it talks about heart attack. If you have severe symptoms, you should go to the hospital as soon as possible, or even call an ambulance.
What about while they're waiting? We hear on television that aspirin is very helpful.
Taking an aspirin can reduce the chance of death by 25%. That's simple one action. If you can get an aspirin, take it, unless you know you are allergic to that or you can have a serious reaction. The best thing in this case will be to take a regular aspirin, not a safety-coated aspirin, because the safety-coated ones are released late. So it is even better if you can chew it. It's a chew it or just take a regular aspirin.
Talk about prevention.
Prevention is the most crucial thing. We know for a long time high cholesterol, blood cholesterol. These are lipids, they are fats in the blood. And then you can look at your blood pressure. Blood pressure is a very simple thing to measure again. You don't feel it. People say they get headache. They can know when their blood pressure goes up. No, you can't. And then keep it below 130/80. Of course, smoking, we know for a long time how smoking affects heart disease. Then you have diabetes, lack of exercise, diet. Keep in mind, people are always scared of taking drugs, but we forget one of the most potent drugs we take every day is the food we eat. The consumption of fat, especially saturated fat, and calories, carbohydrates, simple sugars, all that good stuff, ice cream, pastries, donuts, they raise your cholesterol, the fat in your blood, and they lead to heart attacks. And the interesting thing is, some of the most effective measures doesn't even cost anything. Exercise, walking doesn't cost anything, so long as you find a safe place. Stop smoking, saves you money. Eat less, doesn't cost anything. Watching the diet. So I think some of the most effective thing is actually free.
Well, Dr. Thomas, I want to thank you very much for taking time out of your very busy schedule and being with us today.
You're very welcome.